Hello, this is Dr. Sami Al-Mustanir from Al Faisal University, and with me, Dr. Hamna Abdul Muttalib, a student consultant at the Academic Success Center at Al Faisal University. Thank you so much for Dr. Hamna for her time, and thank you so much for the Academic Success Center represented by Dr. Emily Wilson at the Academic Success Center for their support. So, welcome, Dr. Hamna.
Hello, Dr. Sami. Thank you for having me as part of this series. And I'm glad to be representing the ASC on behalf of Dr. Emily Wilson. And I'm looking forward to this series. And the topic we're covering today is very interesting, very exciting. It's about effective study methods. So it's a huge jump going from high school to medical school. So it's a topic that will help a lot of students, not just in Al Faisal, but otherwise just stepping into med school as well.
Thank you, Dr. Hamna. Yeah, exactly. So, this video is going to help students who can't come to the Academic Success Center at Al Faisal University, and also going to help students throughout the world who might not have access to an Academic Success Center at their institution. So thank you so much for giving from your time, Dr. Hamna.
No, doctor, the pleasure is all mine. And I'm glad it'll help out a lot of people.
So you can start with whatever on your mind for helping students how they can study effectively in medical school.
Okay, doctor, thank you. So basically, what we'll be touching up on today is how to study effectively in medical school. And a lot of people know that it's a huge jump coming from high school, especially in our part of the world. We don't have anything like a pre-med bachelor degree or anything like that. So we go directly into med school itself. So it's a huge jump, and a lot of students find it very hard to actually accommodate from the high school methods of studying and whatever they used in high school. When they use the exact same methods and techniques in medical school, they don't get the results. So you end up seeing a lot of people who were actually like the school toppers. They used to top their classes. They only got A's and nothing less. You see them come into med school and actively struggle, and they go into like depression because like they're not able to focus on what's going wrong, because this worked out for their entire life. So what's going on right now? So it's very important that this issue is addressed properly and we actually like make it clear, because this was something I personally faced as well. The minute I went from high school into medical school, year one was exceptionally tough for me because of how much was changing. I came from a system that completely depended on some other formats of teaching and learning. We had we were not an MCQ based institute. We had different ways of assessment, etc. So going from there to med school, where it's very crucial to know minor details, because everything is important at the end of the day, because at the end of the day you're dealing with somebody's life. So it's in turn very, very crucial that it's that a student is able to master how to study in med school. The earlier the better, because it does happen. Eventually, everyone tries out a couple methods of trial and error, and then sometimes something works out, sometimes it doesn't, and then it's just like that. And by the time they're figuring it out, they've already reached halfway through med school, or even furthermore. So the earlier they figure out how to study effectively, the easier med school is, and it goes more smoothly for them. So the topics we'll be touching on, from all of them, the first and the foremost thing that I want to touch on is time management. So before med school, a student who ideally put in like 4 to 5 hours of studying, if they put in the same amount in med school, they might not be able to get the same result. And that's the obvious facts. Why? Because the details are much more harder, subjects are a lot more excruciating, and you've got to put in a lot of efforts. So the first thing that you got to come to in peace with is time management. While we're on the topic of time management, we also need to discuss burnout. You need to manage your time in such a way that you're not going through excessive burnout, because if you do that, then there won't be consistency in what you do, and you'll end up pretty much giving up at some point, or you're not going to put in the same effort. So for example, I study 1 week non-stop for say 10 hours a day, and then that's going to lead to a burnout naturally. If I'm not doing anything other than just studying on a normal on a day-to-day basis along with my university courses, then that will lead to burnout. So the week 2, what I will end up doing is I will go to 0 or 1 or minimal levels. That just gets rid of the guilt conscious for me that I'm not studying. So it's crucial and extremely important that we make sure that students set a timetable in such a format that it manages their time in an effective manner. There's time for everything. Entering med school doesn't mean that you just give up on everything else that meant meaning to you in life. So it's important that you have your own passions, your hobbies, you sustain all of that. At the same time, you need to be realistic about what medical school itself demands from you. So making a realistic time schedule that involves n number of hours for studying, n number for relaxing, really helps out. Something that someone taught me in back in year 1 was there's the two medical. This is something that's going on. Med students either study all of the weekdays and end up relaxing in the weekend, or they end up studying all of the weekend and then they go day by day in the weekday. So I personally like the approach of studying and giving my 100% in the weekday and then taking a break in the weekends itself and focusing on other stuff. Like, for example, I like sports. So I like to go out and play badminton with my friends, or participate in a game of basketball. So something that really gives me a vent out itself so that I'm not burning out. But at the same time, I know realistically that I can't be in a position where I compromise the number of hours I'm putting in for studying. So I have to make up for it on the weekday itself. So I set a realistic goal depending on how my schedule is, how my time is, and I make sure that those hours are accounted for. If it's 5 hours, 5, 6, 6, 7, 7, whatever the number of hours, it's accounted for. And I make sure that it just keeps going like that. So it's very important that you keep yourself accountable for time. And that's the first thing. And I highly recommend that students draw up a schedule at the start of their week. So what I ideally do here in Saudi Arabia, our week start at Sunday. So what I like to do is right before the week starts, at Saturday night, I like to plan my week ahead. Now, of course, there'll be changes, there'll be ups and downs, and I'll have to move something here and something there. But at the end of the day, I know what I'm doing for the rest of my week. So I'm not struggling with what do I do tomorrow? What do I do now? Okay, I have free time. Where am I spending it? I don't have to worry about that. I already have a schedule planned out. Sometimes, whatever the reasons are, we end up not having enough time. So I end up pushing it. That's okay. But at least for the majority of my schedule, let's say I put a schedule, I will end up following at least 70 to 80% of it because I know what to do. Whereas on the other hand, if you don't have a schedule and you're not accounting for your time, you end up thinking about what to do rather than doing what you must do itself. So that's the first and foremost important thing when it comes to med school. The second thing is...
Thank you, Dr. Hamna. So let's just take a break and then we'll come to the next session. Thank you so much.
Okay, Dr. Simon. You're welcome.